Hello. Have you been thinking about getting any kind of cosmetic procedure done, but you're not sure if it would really work for you, if it is the right option for you, if among the various options available, which one you should choose, and seeing so much information all over the internet and everywhere, you're just confused? If there's only some way to really know exactly what could be done and how it would look, that would be so much better, right? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today I want to tell you about an exciting new feature we have added at the Venkat Center, which is Crisalix 3D imaging software, which helps us communicate with patients in a whole new way. So basically, what was the problem? The problem in cosmetic consultations has always been making sure that the doctor and the patient are on the same page. The patient might not really understand what they should do. They know they want something, but they're not sure exactly what they want, and there are so many options. And the doctor might also find it difficult to communicate with this. Oftentimes doing it by a mirror or just on photos simply wasn't working. And also now with the advent of online consultations, where you're seeing a patient on a 2D small screen, this becomes even more difficult. Many times video quality is bad and communication becomes a real problem. So for that, the solution is 3D imaging. And we at the Venkat Center are happy to announce that we are one of the first clinics in India to offer Crisalix 3D imaging for the benefit of our patients. So what exactly is this Crisalix imaging? Basically, it is a simple way to create a 3D model of a patient's face on a laptop. And that can be rotated, viewed from all different angles. And you can obviously understand how this is so much better than a 2D image. You can really show all the different areas of the face or the body and explain exactly what procedure can be done, what will be beneficial, what won't be beneficial. This can even be done by video consultation by a person sitting at home. Now, you might be wondering, why is this something new? Why wasn't this there before? The reason is that this was available, but it used to be very expensive. You needed special fancy 3D cameras to be able to collect the patient's image, and this could only be done inside the clinic, and it was very expensive. What Crisalix has done is they have used advanced algorithms and software to use a regular phone camera, the one that you have on your phone right now, to be able to take images that can then be converted by the software into a 3D model. And this is what is so revolutionary. It makes it much easier, it makes it much more possible for people to do it from far away, and it makes it much more easy on the pocket as well. So how exactly does it help? So with the 3D model, you're able to show things which you cannot do in a 2D model. You can show things in an oblique view. Before, you could only show in the front view and the side view. And you can show what effect certain procedures can have. For example, hollowness in the under eye, you can show what fillers can do. Chin, lack of a strong chin, you can show what a chin implant can do. Rhinoplasty, you can show how the nose will look like. These are all things that are much better in 3D than in 2D. And coming to other parts of the body, coming to the breast, for example, you can show the effect of breast implants. You can actually simulate and show the before and after what a result will look like with any commercially available implant on the market. And this is a game changer because the patient can actually see how an implant looks on their body, which tells them that, one, do they want this procedure or not? And two, if they do want this procedure, exactly what type of implant they want. So these are just some of the ways that this can help. We plan to use this technology in a few different ways. We want to use it for our consultations so that the patient and the doctor sit with the 3D model on the screen and you can discuss much more effectively. For video consultations, it's an absolute game changer. You don't have to rely on grainy images with a poor network. The 3D can be done ahead of time and then the discussion happens with the 3D. Apart from this, patients can be shown their before and thereafter in a 3D manner. So they can flip it around and see what result their surgery has gotten. And you can also show simulations for certain procedures. For example, breast implants, as I mentioned, the patient can see what the result of the surgery with this particular implant will look like. So these are just some of the ways in which 2D imaging, 3D imaging can help overcome the disadvantages of 2D imaging. So how exactly does it work? Firstly, in the next clip, we will see how photos are taken when the person comes into our clinic to create the 3D model. So to generate the 3D simulation on Crisalix, what we do when the patient comes in this case the patient is our very own Dr. Venkataram, We come in and we take standardized photos in 3 views. We take from the front, we take from the side, and we take from the other side. Once this is done, this is uploaded to the Crisalix software and the 3D simulation is done. While we do this for any patient who comes into the clinic, this can also be done from home. So we send the link to the patient, or the link is available on our website, and the patient takes their own photos with their own selfie camera. They see their 3D immediately. If they're not entirely happy with it, they can redo it. And then once this 3D is ready, the discussion happens between the doctor and the patient. Apart from in-person photos, as I mentioned, the patient can sit at home and take their own image with their own phone. And they see their 3D model immediately and decide whether it's good enough or not. They can adjust the lighting and do it themselves. Also in the clinic, while they're sitting waiting to see the doctor, they can, in the waiting room, they can sit and take the image themselves. This is all done through a link that is sent to the patient. It's a unique link. It's available on our website as well and will be in the description of this video. So you click on the link and then you just follow the steps on the screen. Next, let us see what it looks like once the 3D model is generated. So here you can see the 3D image for Dr. Venkat from the photos that we just took a few minutes ago. And this literally takes like maybe 30 seconds to generate the image. And then once it is generated, it is a complete 3D model. You can see it from all angles and from all directions. And as I said, this was done with a regular phone camera. This was not done with some specialized 3D camera. So this can be done by the patient sitting at home. So this is where this is such a game changer for video consultations. The person sitting at home can upload their photos, create the 3D, and then we have access to it to be able to discuss easily via video call. In person as well, the patient can create the 3D while they're waiting in the waiting room before they come to see me. And then once they come into the room, the 3D is ready for me to show and discuss exactly what can be done. For example, for Dr. Venkat, we could use a little bit of improvement of the tear trough area. We could improve the pigmentation in this area. We could improve these lines on his forehead. So these are all things that show up much better in a 3D image than in a 2D image. This is just for the face. Now, if we were to come to breast procedures, we can also simulate what the results of breast implants can look like. In this patient, we have simulated 300 cc implants, and you can see how that will look from all various angles. And this is really a game changer which will help a patient understand what they might look like after the procedure, which helps them decide on the procedure. So that was our overview of the Crisalix software. You might have some other questions, like one, does it cost anything? No, this procedure is available completely for free for our patients. So if you want to go online and do a 3D simulation right now, you're welcome to do it. Secondly, you might be worried about data privacy, whether these images will be visible to anyone else. The answer is no. These images are visible only to me, the doctor you're consulting, and no one else, even within the Venkat Center. The software, Crisalix software, is HIPAA certified. It is HIPAA compliant. HIPAA is the laws in the United States to protect data privacy. So this software is compliant with those laws, which makes it extremely, extremely secure. You need not have any worry about the safety of your images. So that was our introduction and overview to the Crisalix 3D imaging. We are happy and proud to be among the first clinics in this country to offer this service to our patients. It is always our endeavor to give our patients the best information which enables them to take an informed decision on their procedure. As always, our motto is expertise, experience, and ethics. We will be talking more about Crisalix in the coming weeks to give you an idea of the nuances that it can present. If you have any questions, do get in touch with us. If you have suggestions for other videos you'd like to see, let us know in the comments. Do like and subscribe to our channel. Click on the bell icon to be notified for new videos. Thank you. Have a great day.